Hi, everybody. Welcome, welcome. We'll be starting in just a few minutes. Thank you so much for joining. If you're already here, if you could just drop in the chat who you are and where you're from in the world, just to get a sense of how far and wide our spread is today. Thank you so much for joining early. We'll be starting in just a few minutes.
Neil, you're muted.
That's why you're here, Leah. Thank you. We've got quite a broad spread today. Thank you for all joining on time. Welcome, Courtney from America, Lexi from Slovakia. It's lovely to see we've got quite a broad reach today, which usually happens. So you are all welcome. And we'll be starting in just a few minutes. Okay, another 30 seconds and we're going to get going. Amy, is your camera working? Are you good to go?
Yeah.
We can't see you.
No?
No, can't see you yet.
Oh, my camera's, I can see me. My camera's on. What is it? Just a black?
I've just got a black box. Leah?
I've just got yeah, it's just a box. It doesn't show your, it doesn't show your initials either.
Oh.
Look at
I can see I can see. Is it like LIYA?
Yeah, no, I think they're on about me.
Oh, sorry.
we can't see Amy. That's okay. Thank you anyway.
But it shows my photo. It shows my video on my screen and my name, so that's weird. Don't know. Should I try and leave and rejoin?
Yeah.
Yeah, it might be an idea.
Yeah.
Perfect. We just give it a moment for Amy to log back in. Thank you all for your patience. We'll be getting going in just a second.
Any better?
No.
That's weird. I've been
Amy,
using.
we can see you now.
Ah,
Yeah, okay, I was gonna say I've been using it all morning. Okay,
Yeah,
cool.
we can see you now.
Amazing.
Fine. Leia, can you do me a favor? Could you just spotlight Amy as well? You just do add spotlight. That'd be amazing. Excellent. Thank you. I appreciate your patience. So just wanted to flag up before we get started, just a trigger warning. The very sensitive nature of the conversation means that we will be exploring subjects that may be a little bit uncomfortable, may bring things up for people. This is a safe space. We are here to support you. We're here to have an open discussion. But I just wanted to flag at the very outset that by the very nature of the discussion, it may lead to us being vulnerable and sharing things that could bring up stuff for people that are attending today. And I'm going to start by sort of sharing my own vulnerabilities around this conversation. This is something that I'm very passionate about supporting. It's something I very much wanted to be a part of. But particularly as a man, I've not had a direct first-hand experience of the kind of things that we will be discussing today. And I think for most part this week, I have very much wanted to have this conversation, but also the fears and concerns of not saying or doing the right thing, or not really having the ability to fully understand what it might be like. So just from a personal perspective, I'm just here because I want to support this conversation without necessarily knowing, you know, how this is going to play out. So ultimately, we're here to create a safe space, to have an open discussion, to consider how we can all collectively make things better. Just want to start with, how many of you feel it is important to create safe spaces to discuss uncomfortable subjects like the one we're here to talk about, such as harassment? Okay, I can see many hands going up, both physical and virtual. How many of you are interested in learning how we can encourage and support these conversations so we can all collectively work towards making the world a little bit better, of a better place? Again, seeing hands going up. Wonderful, fantastic. How of you, on the flip side, don't feel it's so important to create safe spaces to discuss uncomfortable subjects, and I'm not sure of how important or relevant this conversation is? Okay, great. Just by the very fact that you're here, I'm assuming that that you are wanting to be able to find ways to be able to have these conversations. But I also wanted to acknowledge there may be people here that just out of curiosity or are wanting to be convinced otherwise. This session is being recorded, and that the only reason for that is for people that weren't able to attend live. So we are able to circulate this to people that have registered but weren't able to make it in person. If there is anything of a very sensitive or personal nature that comes up in this discussion, we will edit it out to prevent people's confidentiality. This is not a lecture. We are here to hold space. My colleague Leia, who's our co-pilot, give us a wave, Leia, will be supporting Amy and myself. So Amy, give us a wave. I'm going to come to you in a second to introduce yourself. As I said, I'm very much also here to support this conversation, but we're here to support you to be able to have an open dialogue. We will be asking lots of questions throughout this session. Please do get involved. Jump on the microphone. You can put your hand up or your virtual hand up, and we'll give you the space to speak. This is not my session. It's not Amy or Leia's session. This is your session, and we're here to help and serve and support you to the best of our ability. So we do really need to hear from you. Questions. We want you to share your experiences. We want you to disagree, seek clarification. If I get excited and start speaking very quickly, tell me to slow down. Whatever you need, feel free to jump at any point. And particularly given the fact that from what's been shared already, we do have quite a diverse international audience. We're really grateful for you for investing your most valuable resource in being here today, which is your time. Just a couple of ground rules just to ensure that we do have a safe space to have this conversation. We have a tiny amount of time. We have, now just under an hour to have this conversation. So make the most of this time. Do your best to be fully present. Limit any other distraction. Turn your phones and iPads and other screens off, or put them on silent so you can be fully present to this conversation. Participate. What you put in will determine what you take out. There is no right, no wrong. This is an opportunity for us to have open conversations and to understand each other, even if we disagree. That's okay, as long as we can kind of hear each other's perspectives and try and understand each other. I'm going to encourage you to be fully present, have an open mind, even if there are things that are shared here today that you don't have a direct experience or understanding of. To be, as Chelsea just said, being non-judgmental and kind, absolutely. Using I statements rather than speaking on behalf of others, in my opinion, I think that. So you're taking ownership of any statements that you're making here, being open, honest, and respectful. Confidentiality, so what we discuss and share in this room stays safe here in this room. Other than anything that Amy, Leah, myself, or Anise share, you have our full permission to share that with anyone that's willing to listen. But each other's stories and personal experiences don't get shared outside of this space. And the only the only other caveat to that is for safeguarding reasons. If someone mentions anything in this session that impacts your safety or the safety of others from a duty of care perspective, that's the only time that the rules of confidentiality be broken. Are we all happy to agree to the ground rules? We just want to ensure there's some parameters wrapped around this conversation to make it safe and accessible for everybody. If anyone has anything you'd like to add, change, remove from the ground rules, feel free to jump in on the chat or to let us know. Thank you. So I'll start by introducing myself. Many of you may know me already if you've attended our webinars before. My name is Neil Shah. I run an international non-profit called the Stress Management Society, which I set up in 2003 off the back of a first-hand experience of my mental health, which led to me having a breakdown, and the depths of which I got to the point where I didn't want to be here anymore, and I actually took action against that. Thankfully, I failed, but it ended up being one of the most powerful experiences of my life because it led me to set up this organization. And at the last count, we've reached more than 100 million people with our various different campaigns, programs, and projects that we've been involved with. We also run a research and consultancy organization called International Wellbeing Insights, through which we do a number of different corporate programs. And essentially, at its core, our vision is to create a happier, healthier, more resilient world. And in that quest, we come across many subjects and many areas where societally we do need to take action. And meeting Amy some time ago when she was in a different role was a really amazing meeting of minds. I really enjoyed working with her on a project which was very much around health and well-being. And when she set up her own initiative, it was kind of a natural progression for us to collaborate, given what she stands for is also to make things better, to leave the world better than she found it. So Amy, over to you. Would you like to introduce yourself and tell everyone who you are?
Yeah, thank you. So my name's Amy, as Neil said, and yeah, I own a social enterprise called HASSL. I founded it the end of October 2024, so we're still very new, but we have grown very quickly, and essentially we're all about tackling harassment at the root rather than giving women more safety tools, more self-defense tips, things like that. It's essentially all about tackling it at the root instead, and that is through changing the way that public spaces are designed, through tackling male violence, which is a significant challenge for us. It is through tackling systemic sexism, misogyny, kind of the the consequence of the patriarchy, essentially, and barriers to reporting. So kind of all the things that stand in the way of, after incidents happening, that people don't actually go on to report, and therefore the kind of scale of this just continues because we kind of feel that would be a barrier to hopefully slowing it down, if not removing it altogether. So that is what HASSL is, and as I say, we've been going just 7 months now, so we're pretty new, but we already have almost 2,000 volunteers, which I know a lot of, or some of you are here today, which is amazing, so thank you. And we have a reach at the moment on socials of almost 450,000 now, I think, and definitely over 400,000 followers. So we are basically working on a 5-stage plan, which is a combination of tech, tools, and training to tackle all the issues that I mentioned that we feel are the root causes of harassment, essentially. So that's my little intro for you.
Thank you, Amy. And I just want to remind everyone, this isn't a men versus women issue. This is everyone that stands for change and to create a positive society for all of us and for future generations against those that may not see it that way. And this is really where there's an opportunity for us to come together to consider the challenges we face in our society and to be able to take action and do something about it. As a society, we generally tend to take action against the things that we speak about. I know this firsthand from being a professional in the mental health space for 22 years, that is one of the biggest issues that affects modern society, yet it's one of the most uncomfortable things to talk about. Mental health is right up there with sex and money in terms of the three most uncomfortable subjects for a human being to talk about. And even though we've arrived at a point where suicide is the main cause of death for a man under the age of 50 and for a 10 to 19-year-old in Western society, it's still one of the things that we're not doing anywhere near enough about. And this is another one of those subjects that, because we're so uncomfortable talking about it, we aren't taking the action that's required to create positive change. And this is really where, for every one of you that's here, male, female, or other, that's contributing to this dialogue, that we welcome you. And as I said, it's an open space for us to have this conversation and explore something that we don't generally do on a day-to-day basis. Amy, can I just kind of get a sense from you? What was your motivation? What sparked the desire to set up HASSL?
I think so my background is social impact and entrepreneurship in various forms. And I kind of always knew that I've been, as Neil said, I think we got on very well because we were quite similarly passionate about a lot of different social issues and things. And that's what I've always wanted to do. And then I went to university to do entrepreneurship, and that was where I found kind of social enterprise, which is essentially kind of a hybrid between a business and a charity. And in my opinion, kind of the best of both worlds, where you're not limited in ways that charities tend to be in terms of fundraising and things like that. And you're also not putting the profits into people's pockets. They're going back into hopefully things that make the world better. So that was kind of when I found out about social enterprise, I was like, that is what I'm going to do. And then I've worked, because of COVID and various other things, I ended up working, which is, as Neil said, where I met him. And and then basically just living in London, had a lot of different experiences of being harassed in various levels of extremity, if you want to call it that. And and just kind of got sick of hearing the same things literally every single time I went to a networking event, every time I had a client meeting, every time I saw my friends. Like, it was just, the scale of it was just ridiculous. And I think also the way that we've just been taught to be quiet and get on with it, and that it's just a part of life, and that it is very much, the responsibility is very much put on women to not wear that, don't say that, make sure you navigate the situation well, all that kind of thing. And we talk about it in a very different way to how we talk about other kinds of crimes, where we don't hold the victim to the same level of kind of accountability. And I think there is, gender plays a part in that, the patriarchy and all this kind of stuff, as to why we, women and men, think that that's okay and normal. And as Neil said, it's like HASSL is very much about inviting men into the conversation. I think I never want to talk down about other organizations or anything, but I think a lot of women's organizations that are trying to tackle violence against women don't involve men in the conversation, and we can't really ignore the fact that men are involved in this issue. So it's about how everyone can come together and create a better society, and also not just removing, I guess, responsibility from women from a different perspective, where women have internalized misogyny or where they victim blame and stuff, because that still happens a lot. So it's just about how can everyone sort of meet everyone where they are on that scale of understanding the problem and advocating for the problem, and try and shift them up towards doing more, essentially, to create a safer world. So that's kind of, I guess, sorry, I went on a bit of tangent there about inviting men, but I know you mentioned it, so I thought I would mention it too. But essentially from personal experience, I know we mentioned, do you want me to go into a story? I know we kind of mentioned talking about it, but should I give one, Neil? Or?
Sure, yeah, please do. Please do.
Okay, so I mean, as I say, I have a lot of incidents. I think the one that actually wasn't the worst one, and I say this is not too hopefully triggering, but just to put it out there, I'm going to talk about this. so yeah, this was kind of the one that I guess was the catalyst to starting HASSL. When I was like, I'm at the end with this, I'm at the end of my tether. That's it. Was basically when I was working in my last job, I was on the train in the middle of the day, was like 10:30 or something. So it was very much, you know, daylight, busy train, full of people that obviously also were kind of out for the day, not in a rush, not like on the way to work. I was on my way back from like a meeting to go to my office, and I was basically walking down the platform to get on the train. And as I walked down the platform, I saw someone like staring at me like very intensely. So I purposely walked to the other end of the platform because, again, it's a bit hard to explain, but I feel like as a woman, you just automatically kind of have your senses up, and you kind of know that it might not be quite right. And yeah, so I was just like, right, I'm gonna go sit at the other end. Anyway, got on the train, was on my phone doing some work, look up, and the guy sat right next to me. And I was like, my heart just went, because I knew that I'd gone to the other end of the platform purposely. So I was like, and I knew it was him. And I was just like, oh, here we go. And then just basically continued for the journey to ask me personal questions, touch, not sort of, I don't want to say not inappropriate because it is inappropriate, but nothing too graphic, but just
Have you fed?
touching me, bashing me, like asking me questions, like when I put my earphones in, try and take them back out my ears because I was like, I'm working, sorry, was trying to be very polite. And I think the thing that got me wasn't that situation, but it was the fact that everyone on the train just looked away, like no one batted an eyelid, no one did anything. It was very obvious, like I was purposely being loud. There was a lot of people on the train, but it was pretty obvious what was happening. And then when I got off to go to work, he kind of grabbed my hand to like pull me back because I hadn't done what he'd asked for or whatever. But to me, I think it wasn't the situation. Obviously, then as a woman as well, like I don't want to speak for all women, but I think generally then you're like, am I going to be followed? Should I get on another train instead of leaving the station so that, you know, I'm not vulnerable, all that kind of thing. And yeah, I think for me, the biggest thing was like, you know, I'm a relatively young woman. I was by myself. No one even just like, you know, nodded in my direction to be like, I've got you if this escalates or anything. And I think that was the biggest thing for me was I like to think humans are inherently good. And I don't think people just didn't care. I think it's that people don't know how to do it and are worried about escalating a situation or doing something that isn't the right thing to do. And that's where I feel like especially needs to be a lot more training and education and stuff like that. So that was kind of like, as I say, a relatively tame one in the scale of things. But yeah, I've had many situations, and I think I also had quite a lot of colleagues the same week have situations that involved the police and the police not really doing anything and having evidence and all this kind of stuff. And yeah, so it all just kind of reached a point where I was like, okay, I really, really need to do something about this. So yes, that was kind of, I guess, the final straw for me. Yeah, that made me really start it. So yeah.
Thank you, Amy, for being vulnerable and sharing that. And I think there's much to unpack just from your personal share. One of which obviously is your experience, but also the fact that you were in an environment where there were other people that, as you said, like, was it because they didn't want to engage or they didn't know how to? Someone I've had the opportunity to get to know relatively well, Johnny Benjamin. I interviewed him on my podcast, and we've had the opportunity to spend some time together over the years. Those that have kind of follow the field of mental health would have come across the name Johnny Benjamin because he wrote a book, Stranger on the Bridge. And cut a long story short, essentially he'd got to the point where he was done with this life, and he went to Waterloo Bridge, 9 o'clock on a morning. I can't remember if it was a Monday, but it was like a busy weekday, and he was standing on the bridge ready to jump off, and a couple of hundred people just walked past. Like, there's someone there clearly in a place of distress where they're ready to end their own life, yet we have got to the point where either we're so uncomfortable or we're so kind of focused on what we've got to do that we just don't engage in the things that are happening around us. And it's tragic to think that there are people around us that could be struggling or suffering, and we've arrived at a point where societies or communities are so degraded that we don't even engage. Last year, London won an award of being the loneliest city on the planet. There's 9 million of us, 9 million people that live in London. Yeah, many people are feeling disconnected and isolated. It's because is it we don't know how to, or we don't have the time, the capacity, or the ability to care about what's happening around us. And I think that's definitely something for us to explore. I think before we get to the how do we make things better, I think there's some questions here to bring everybody that's taken the time to attend today's session in is, what, from your perspective, from your experience, obviously Amy's and been very vulnerable at sharing her experiences. What are the forms of harassment that you've witnessed, experienced, observed around you? In any shape or form. Obviously, it could be as a woman from a man. It could be, racial. It could be gender. It could be whatever. But let's kind of get a sense of what is the issue and the scale of the issue. And if any of you feel comfortable jumping onto the mic, it would be really good to hear some of your stories, because just to get a sense of what is it we're here talking about. As I said, we've got some examples here, but I'd love to hear some more. Anyone comfortable sharing sort of what are your observed or experiences around harassment? And just while we're waiting to see if anyone's comfortable jumping onto camera, Leah, would you bring some of the chat comments in, please?
Yep. So someone said wolf whistling, verbal or threats of violence. Someone else said intimidation, stalking, physical space, blocking, etc. I saw that someone lives as trans being backed into I think it's meant to be into a corner by some young people the other day, showing inappropriate images or messages. Women getting unwanted attention from men, including touching, gaslighting, again, unwanted touching. So I think a lot of it is kind of those underlying things as well, like small little things, like, for example, gaslighting as well, exclusion, intimidation, and threats, not taking no for an answer, forcing a hug, microaggressions.
Thank you. Has anyone got any experiences or stories that you'd like to share? It's an invitation for anyone that would like to come onto the microphone to talk about your experiences. I think the better we understand kind of the challenge we're facing, the easier it is for us to be able to take appropriate action to do something about it. So it'd be lovely to hear from you. Chelsea, go for it.
I thought I'd share a time that, and it seems to always happen on trains. I don't know why. But I was travelling back from a show with my mother, my aunt, and my sister and my cousin, and a gentleman came onto the train and sat in front of all of us and exposed himself to all of us.
Wow.
Yeah, he thought he was doing it quite not with so much. He thought he wasn't being obvious about it, but we all sort of just kind of looked at each other, got up, walked away, and then he followed us, sat down again in front of us, still exposed. When we got off the train, we then just reported it straight away to the police. It was quite a quiet train anyway, and we reported to the police straight away when we saw some police officers that were on the platform. I don't know obviously what happened after that point, but yeah, that was very intimidating, quite scary, and just a horrific event, really. So yeah, that happened to us.
And Chelsea, I think that there's an opportunity for us to kind of move on to the next part of our discussion. Is what is the impact of that? Obviously, that's what happened. What effect did that have on you? So because it's not just what happens in the moment, as Amy shared from her story, that it's what happens afterwards. So what was the ongoing effect of the experience that you had there?
I travelled on the train a lot for work, and it meant that at least for a couple of days, maybe a week, that I wanted to work from home. a little bit more. I didn't want to step back on a train just in case something like that happened again. I definitely now do not like to travel at a specific time at night on the train if I'm by myself. I like to be with somebody. It makes me feel a bit more comfortable with being with somebody, I guess, having that backup. But because I mean, it happened with other people there, so I think sometimes they don't think about the fact that you're with other people, but it makes me feel a bit more comfortable. And I think actually, if I was to look at it again and it happened and there was a bigger group of us again, I might feel more inclined to be more vocal about it as well. If there were more people with me, obviously, if I was by myself, I wouldn't. But I might feel more inclined to just make them aware that that's not acceptable behaviour if I felt safe enough in that situation to do so. But as I say, I kind of try to not travel so much at that time if I'm by myself anyway. But yeah, it definitely had an impact, at least for a week or so, on me going in and out of London in the daytime and the nighttime. Yeah, feeling a little bit scared, I guess, feeling a little bit unsure about what was going to happen again if I'd see that person again, no matter what train line I was traveling on. So it caused a little bit of anxiety, I guess, for that week. With my aunt and my cousin live in Wales anyway, so they just went back home, but we were still talking about it even just kind of a couple of weeks later. So yeah, it sort of just didn't go away. It was just talked about a little while, but I mean, it was probably a couple of years ago now, but and when you look back on it now, rightly or wrongly, we kind of just have a bit of chuckling moments about it, which is probably wrong to have, but also maybe just a supportive mechanism for our own to guide our own mental health now about not feeling so anxious about the situation, maybe.
Yeah, absolutely. Thank you, Chelsea, for sharing and being vulnerable. And for anyone else, like, you know, when you have faced experiences around harassment for whatever reason, what has been the ongoing effect of that? Obviously, I can't relate to it from the perspective of a woman, but there has been times I've experienced harassment for other reasons. And I know that affected me and may have made me uncomfortable in certain situations, or to show up in certain settings. What has been the effect for you? And this is an opportunity for you as the participants of today's discussion to share sort of what happened. Like, how did that affect you? And again, there's an invitation for anyone that feels comfortable to jump onto the microphone as well. Go for it, Carla.
I can share an
Thank you.
example.
Uh-huh.
I'm going to try to do it in the quickest way, but I think the invitation you've just offered really helped, or this point is about it. For me, it illustrated the way that calling out harassment leads to further shutdown for me in this example. So I was there were some people in a parking garage really yelling and screaming, and I was just concerned for other folks coming into that parking garage, so kind of texted a warning. And because it was an organization, let's say a corporation, it was in a mall, so they had to follow their protocols of fill out this report. Did you know where the emergency button was? Did you call security? All the issues became my responsibility. The folks who I was worried about coming into the garage weren't addressed. No one said, oh, be careful, there's some dangerous situations in the parking lot. And then because of all the red tape and the discouragement and the reports I had to fill out, I was just like, I'm not doing that again. I won't do that again. And it just illustrated the bigger picture to me of the systemic way we are shut down and discouraged from trying to call these things out.
Yeah, I think, I mean, to add to, I think so, like, that's so fundamental, because the reporting process, whether you're a victim, I don't really like to use the word victim, but a survivor or a witness, a bystander, whatever, it's so complicated. It requires so much evidence, and then the evidence isn't good enough. And then there's a whole, and that's if you know where to start. If you're traveling, if you're a student abroad, if you're doing any of those things where you're out of your normal comfort zone, you're so unlikely to do it. So it's just like and also, you know, a lot of people have distrust within the system anyway because of past experiences, like you said, that makes them, whether it's from a, I guess, dismissive angle, or whether it's just from purely how much time and effort it takes. And I think it is almost like it almost feels whilst you're doing that you're not being trusted, because of the amount of evidence, the amount of, did you do this right, did you do that right, you know, all that kind of stuff. So yeah, completely agree.
Yeah.
Just wanted to,
it was very diminishing. My friends and I call it the red button scenario now. So when we call out these kinds of injustices in society, it's just like, it was another red button thing, because I was meant to find the red button and push it. Yeah. Which I'm not sure what would happen if I pushed it, quite frankly. Like, I don't know what would change.
I mean, there was an incident recently in London where a woman was attacked. I think she was, I want to say punched, but I might be wrong, on a train. It was like a few weeks ago. And she pressed the button on the platform that we have, and no one came, nothing happened. And she was there by herself about 20 minutes, pouring with blood, all by herself, and no one came. And that was in a London train station. That happened very recently. So yeah, I think, again, it's like we put a lot on potential victims, I guess, like people who are more vulnerable, to keep themselves safe. And even if you do everything right, it still doesn't necessarily give any benefit. And then you're just carrying, I know we're kind of talking about this, carrying this mental load constantly of trying to think, should I have done that? What will happen if something does now happen? Will it be that I shouldn't have been on my own, or I should have worn a longer skirt, or I should have put a coat on that covered me up, or whatever? And just a million different things that I think a lot of women especially don't even think that they do, but they do it almost subconsciously because it's becomes so normal, if that makes sense. So yeah.
Thank you, Jennifer, for sharing. And I think we do also need to establish that, you know, and pretty much based on what's just been shared, there are barriers that prevent people from creating safer environments to speak up and tackle the issue. So how do we create safe space for healing while still encouraging others to be part of the solution? Because I appreciate that when we have these kind of tough and challenging experiences, it could be very easy to blame people from a particular background. But I think what we really need is everybody involved in being a part of the solution. And this is obviously something for me that's really key, is the more people that are involved that are standing for change, the more likely we are to be able to make positive, meaningful change. So what do we need to do to create those safe spaces? What are the barriers that exist, and how do we break those barriers down? So who's got some thoughts? Carla, I know you had your hand up. Is there something that you'd like to share? Carla Sayers.
Sorry, I'm a bit sick, so ignore the voice. I've been a bit sick recently. No, I was just going to say, it was more to the last question, but I think post harassment or hearing stories, or whether it be that you have been harassed or your friends have, or whatever it is, I feel like it just instills this fear in you that you don't really know how to judge every scenario. Like I think of an example which I did post on the HASSL page not that long ago about, I had someone follow me into a shop and come up to me and basically say that they wanted to take me out for lunch. And look, initially I thought, you know, I probably should be flattered by that. But post it happening, leaving the shop and walking home, I was checking behind me. I was checking he wasn't following me around the corner, that he wouldn't know where my house was. And I even considered walking around the block. So I think it's about, you know, that person may have had good intentions, although the way they went around it was very poor, and I don't agree with him following me into a store to approach me. I think whether it be that it was good intentions, the aftermath of that as a woman walking away, the fear that you feel because of other things that may have happened in your past, you do just kind of second guess every scenario, and you don't know whether they had good intentions or bad. So you do just, I guess, take all precautions.
Yeah, I hear you. And Amy, what's your thoughts on this? What are the barriers that are preventing us from being able to create positive change? Obviously, I know I very much appreciate that's what HASSL stands for, but what are the issues that we're trying to break down here?
Yeah, so I mean, as I said kind of at the beginning, like there's 4 key areas that sort of HASSL is built on in terms of things that I believe need changing to get us to some kind of mass change in culture shift and system shift. And that is the sort of essentially design and thought around public space design. Again, this is all about shifting responsibility away from individuals and onto society. So one is how literally like public transport is designed and how all the things that they have in place and that they actually follow through with them, and that, you know, historically things are designed based on men as default and even male anatomy and things like that. So it's, you know, and this is partly what we're doing, is working with public transport and things like this to create safer spaces rather than expecting the individual to make themselves safer somehow. The second thing is a lack of awareness in general is such a big thing. I think generally, like, again, not to like stereotype, but when it comes to this form of harassment, it is typically men against typically women as the victims and perpetrators. Not always, but that's where a lot of it, you know, stems from when we talk about patriarchy and stuff. And the lack of awareness of like day-to-day things, not only of the experience and the aftermath, but just the day-to-day things that women do to try and prevent these things happening from themselves. There's a lack of awareness even between women that we do that, right? Until you start talking about it and really like breaking it down. You know, this is all things that I've done my whole life, but and I would like to think I've been pretty into, you know, these kind of issues from being very young and like thinking about this stuff. But you just think this is the way it is. We're like, we just have to, you know, and it starts when you're so young. Like, you know, most women, I think it's in the UK, it's, I want to say 70% by the time they're 15 and 90% by the time they're 17 is the most recent statistics now of experiencing being catcalled, harassed, or worse in public. And it's just like generally, I think, like when I had that incident that I talked about, I did a LinkedIn post about it, and I didn't used to post on LinkedIn at all. The amount of men afterwards who worked in the same place as me, who came over to me and was like, I just did not realize this was a thing, like this happened like this. And I was like, if you don't even know the half of it, if that's what's kind of in the nicest possible way, like if that's the thing that, you know, and a lot of them said to me, I've got daughters, or I'm really, is this what world they're going to be? And I'm like, I mean, yeah, unfortunately, like this is not rare. This happens all the time. And I think just generally a lack of awareness, you know, as I say, not just from men, but from women themselves at realizing, you know, a lot of women say, oh, well, this is just what happens. Or some women say, oh, it's a compliment, like Carla was saying. And it's like, it isn't just about the actual act of whatever happens. It's about, you know, people might have innocent intentions, like Carla said, but we have lived experience of potentially what can happen and what can go wrong. And that's unfortunately what happens. So even if you do have good intentions, it might not be perceived that way. And being aware of how you speak to someone, if you want to approach someone or whatever, you know, that is on men essentially, who, you know, women will have inherent fear from because of what's happened to them. It's not saying that that person is a bad person or anything like that. It's just being aware that, you know, being backed into a corner is a little bit terrifying when you don't know what, you know, if you say no or whatever is going to happen next. So I think that awareness piece is so big, and I think people underestimate sometimes how important that is. The third thing is, again, just a nice big one, but essentially just dismantling all the systemic sexism, misogyny that we live with every single day. A lot of what we try and do is try and like flip the script or kind of strip it back instead of going in with kind of statistics. It's just like, why is it that we say this thing about women and we don't say it about men? Or why is it like, and just trying to like take it back so it doesn't feel, you know, because again, a lot of some of it comes from women too. It's not just men that reiterate the narrative. It's women that, you know, say women should do this, women should take it as a compliment or whatever it is. So that's a really big part, and that's where, you know, for me, the education thing is so important. And we have bystander intervention training for workplaces, but we build in this systemic sexism, misogyny piece into it because it's so important to revisit why is it that girls wearing skirts asking for it and boys walking around with the tops off are just existing, because we don't see that in a sexualized way. But, you know, if anything, they've got less clothes on. So it's like, well, why is it we think this way? And it's just kind of trying to break all of those things down. And yeah, which one I haven't covered? And the barriers to reporting, I think, is also a massive one. And obviously, and talk about this in terms of on an individual level. On a systemic level, obviously, there's a huge problem with trust, with the process of reporting being so complex, with the default being, unfortunately, the perpetrator tends to get away with it, because unless you've got a lot of evidence and all this kind of stuff. So yeah, we're building tech to hopefully change the way that is done, but that's another thing. But even on like a personal level, I think creating space for people where they feel like they can talk about what's happened to them. I think as soon as you start having a victim blaming, like you say it in a group, people know that they can't trust you. They can't tell you their story, their experience without feeling like, are you going to judge them for it? So it's even just trying to create those spaces, like on a personal level, when you're talking to people. Obviously, I would love for everyone to help with breaking down the barriers to reporting from a law enforcement, all that kind of stuff. But obviously, that's a bigger job, and something we are working on, and people are very welcome to join and help. But yeah, I think even within your own communities, your own circles, like the biggest thing is that a lot of people don't tell anyone that it's happened to them. So that could be the catalyst for them then going and reporting, or they don't want to report because they don't feel like they have anyone to support them in reporting, or they're scared they're not going to be believed. And it's like, well, even if one person believes them, that might be what it takes. So I think it's being mindful of even what you say, because you don't know what people around you have experienced, and what kind of message you're sending to them if they've gone through something and are wondering whether to share it. So yeah, sorry, that was a long one, but
thanks, Amy. And I think the key thing there, and it's what Christine said in the chat, is we do need to normalize talking about it. You know, there are a lot of things that, as we've mentioned already, that are very common in society, but we don't know how common they are because we just don't talk about it. Miscarriage is another example. Like, I think it's 1 in 4 pregnancies end in miscarriage, but most people don't know how common it is until you've had an experience. And if we did, then how could we get better at supporting each other when we have kind of challenging and tough experiences? And, you know, even hearing some of the things today, like some of it's like, wow, the scale of the issues, because it's not something that, you know, I know that this happens and I know that it's a big issue, but when you hear these stories, obviously that kind of, that's really compelling, and it's quite emotionally challenging to hear these things, but then that should be compelling more of us to kind of get involved with making things better. And I just want to share something, and Hayley, I know you've got your hand up. I'll come to you in just a second. That I was, and please don't shoot the messenger on this one. I'm just quoting something that I was exposed to, which for me was a fascinating thought. I was speaking at a conference, probably about 4 or 5 years ago, maybe a little bit longer, and somebody came onto stage and posed a question, and the question was, why is there always a queue at the women's toilet and not at the men's? And everybody laughed, but it was like an actual serious question. And there was loads of different responses, and women take longer and this, that, and the other. And he said, no, absolutely not. They've done time and motion studies, and, you know, generally speaking, it takes a woman about the same amount of time as a man in the toilet. And essentially, this was a conference for engineers. He said the main reason that there is always a queue at the women's toilet, and as I said, I'm just quoting the story, please don't shoot the messenger if it's not accurate, is that most engineers and architects in the world, I think it's like 75% plus of engineers and architects in this world, are men. So they are designing a solution that they cannot possibly have a first-hand experience of because they've never used the women's toilet. Does that make sense?
Yeah.
And as they started to invite more women into those kind of those spaces to create solutions, they were able to find alternatives which actually lessened the load and the queue times at the men's. Now, obviously, there's a variety of different solutions that you now see in big cities like unisex toilets. I've been to a few festivals in the last few years where they've got like the female urinals, and actually, you know, like having been there with my partner, she spent less time queuing than I have. So what I'm saying, and it was fascinating, whether it's true or not, the thing that I took from that is the service user should be front and center of designing the solution that they're being impacted by. And you mentioned that in terms of public transportation, in terms of common spaces, in terms of kind of, you know, if you've got people that understand the experience, that have first-hand experience, they can be contributing to creating solutions in a way that someone that doesn't have that first-hand experience can't. And I think that that's a really, really fascinating point. Hayley, go for it.
Can you hear me?
Yeah, loud and clear.
Yeah, cool. Just on the conversation of barriers, I think one thing that's always stands out to me is allies feeling unsure or scared of doing the wrong thing.
Yeah.
And in the work that I do, a lot of the work I do in the D&I space is focused on building ally networks and encouraging people just to feel empowered to step up, even if they completely cock it up and do the wrong thing. It's better to do it wrong with good intentions than leave somebody completely struggling, feeling isolated, feeling alone. And I think when we talk about harassment, we know that there are a lot of men and people of other genders who are allies, but I think they also have fear that if they step in, they might be seeing themselves as predatory in some way, or, you know, they don't want to give the wrong impression, put their foot in it, do something that will make somebody who's potentially a victim even more uncomfortable. But I know from my personal experience that every situation I've been in where I've been being harassed, it's always been a woman who has stepped in. And I think that is because women naturally build communities and networks through, you know, sharing experiences, being vulnerable with each other, all the things that you are quite rightly saying we all need to do more of as a society. And I think if allies, and particularly male allies when we're talking about harassment, can build those networks and those communities better, I think they'll feel more empowered to contribute to this topic. Because as much as women can share experiences, and, you know, people who've been harassed in any capacity or subject to discrimination can share experiences, there's also still a burden on the oppressed group when that's the case.
Absolutely.
So it's completely right that women and other minorities should be front and center of these structural things where we've been excluded in the past, but also it's getting that balance right, isn't it, of, you know, not wheeling out the one trans person, you know, every time you've got a trans topic to discuss.
Yeah, absolutely. I mean, I think, yeah, HASSL is very much like designed around men, because I agree, like that's always been the kind of issue, that they're not involved in the conversation. And we have started having men's focus groups every 2 weeks, and we have male ambassadors who are working on projects with us now. So it's very much like part of what we're doing is trying to bring more and more men into the conversation. And like you said, I think, you know, I had a conversation with someone a while back and they were like, it should be like first aid training. And I was like, yes, exactly. It should be in every workplace. It should be, you know, because you say, oh, it's not, but that can lead to, even if it doesn't lead to injury or death, it can lead to a lot of trauma. It can lead to, you know, as we've just talked about, a ongoing like mental stress of having to deal with, you know, go out in public every single day after something happens. And you know, it should be, I agree. I think whenever I've had people step in, it's also been women. And I do think there is also that issue, like you said, where men are worried about coming across in the wrong way. And it's just about giving people those tools in the same way that we do with like first aid, CPR, whatever it is giving people those tools to be like, okay, this is how you can do it in a way that's not going to escalate the situation, but that's also going to make the person not feel like they're on their own, because that can make all the difference. Like even just feeling like someone's aware of what's happening to you, even if they don't do anything, just their presence can make a difference, like in that situation. But yeah, I definitely, this is why like it has to come from all angles, because there's issues everywhere that allow this problem to continue. It's not just it's not just a male violence problem or just the way that things are designed, that it's from everywhere. So yeah, completely agree. And yeah, thanks for sharing. Sorry, Neil, Karen.
I was just going to kind of share from my perspective. Obviously, Hayley, as I said at the outset of the call, that had come up for me as coming into this session. I am totally comfortable having uncomfortable conversations, and we talk about issues around suicidality and mental health, and I get to deliver my programs across the world, and I'm totally comfortable having uncomfortable conversations. I'm going to say, in the last 10 years, this is the subject that has. This session itself has been the one that I've kind of come into with a little bit of fear and trepidation about saying the wrong thing, because as much as I really care about being able to build healthier, better societies and communities, there is a fear as a man of coming across like you don't understand, or you can't relate, or you've said the wrong thing. And I think when that happens, the fear is that for a lot of people, they'll say nothing at all. And obviously, from my perspective, I'm definitely going to be the kind of person that would say something, even if I'm concerned about saying the wrong thing. But I can also totally appreciate how a lot of people would just stay silent for fear of getting it wrong, because it is a very uncomfortable subject to approach as a man, because you don't have a first-hand experience of it. In the same way that, for example, like someone of one particular ethnic background couldn't speak on behalf of the experience of another, because they're never going to have that first-hand experience. And this is really for us where, with the little time that we've got left, we want to introduce an idea of how we can make things better. And there's kind of two aspects to this. One is community. We're coming out of the other side of Mental Health Awareness Week last week, where community was the theme. And a healthy, robust, well-functioning community has the way of being able to address and tackle issues without the need of authority figures to do so, because you have kind of a self-regulating system, because the community looks out for each other. And the other one is we need to flip the switch. We need to flip the narrative. And I'm going to let Amy talk through how we flip the narrative. But let's start with community. This is really why it's important that everybody, whether those first-hand experiencing the challenge or those that can provide allyship or at least be empathetic towards the needs of the others, is crucial. Where we're able to come together to create safe spaces to have uncomfortable conversations, and to be able to regulate the issues that we experience as a community collectively. When I was a kid growing up, I grew up in southwest London. I remember after school, from the age of like 5 or 6, I would be given a packet of crisps and a glass of orange squash, and then sent to the park with my friends to play. And we were free to play by ourselves. We'd fall out of trees and scrape our knees and be out on our bikes and playing football to my mum screaming over the fence to come in to have my dinner. There was a park keeper in the park, and he had a dog called Chip, and they basically were the responsible adults. I remember when I was about 8 years of age, I stole a cigarette from my granddad and a box of matches, and we went to the park and we tried to smoke a cigarette because we wanted to be cool like my granddad and my dad. And the park keeper caught us, literally grabbed us by the ear, probably gave us a slap round the bum, and dragged us home to our parents, who then had a go at us and took the side of the park keeper. That wouldn't happen today. That couldn't happen today. A park keeper would get arrested for laying his hands on a minor. There wasn't that, there isn't that sense of community today. I'm not saying it's good or bad, or it's right or wrong, but what I'm saying is that there was that sense where people looked out for each other. They knew each other. It is very much less so today. Very rarely do parents let children out of their sight. And what I'm saying is that when you've got that kind of sense of community where we are together and we look out for each other, that means that people are more likely to step up or step in when things are happening that are not appropriate or suitable. And I think that this, exactly as Hayley said, that where this starts for me is healing that sense of community, where that community is your neighborhood, the people that you live around, your workplace, your family, your societies, and where we can get to the point of a healthy community, we start to address and eradicate some of these challenges. And that's one of the things that I wanted to drop in, is how can we pick up on some of the things that we have started to bring to the table by way of discussions around community. And Leah has got a really great a white paper which we can share around community, which was written for Mental Health Awareness Week. But The other part of this is let's flip the script, and I'm going to let Amy lead us through how we flip the script.
Yeah, so I think it's obviously really helpful to have some of these frameworks, and these are the kind of things that we're actually building into online education resources that are going to be free for everyone to use, whether it's on bystander intervention or whether it's on challenging, as we say, like misogyny, I guess the norms that the patriarchy is creating, things like that. So yeah, the first one, the F, is face the facts. So essentially acknowledge that there is bias in the world. I think it's really important, and it's easy to get, you know, defensive sometimes if you are in theory the oppressor in the situation. Like, we'll take racism, because I am white and I have to acknowledge that I benefit from white privilege. It doesn't mean that my life is perfect. It doesn't mean that I don't suffer in other ways. It means that generally the system was built to benefit me. And I think that's really important to remember. So it isn't an attack on men. It isn't saying men don't have their own problems or issues. It's saying that generally, like Neil gave a great example, is things are built by men for men, and then women are inherently at a disadvantage, and this goes into all different parts. So I think it's really important to try not to feel defensive about it, but just acknowledge the privilege. And again, it doesn't mean that you don't have disadvantages elsewhere. It's just recognizing where you do have privilege and the way the world is built for that, I guess. It's really, the L is for like listening and learning. I think it's really important from an education perspective to not only read, books and listen, join things like this and listen to podcasts and whatever it is around this, but also just to listen to, especially the women, if we're talking about this situation or this kind of thing, the women around you, and just listen to their stories. Like, it's very rare that people ever ask me, like, as much as I have great men in my life, and it's very rare that they ever ask me, or like when I say something happened, they go, oh, that's shit, or whatever. But it's very rare that they'll actually say, oh, how does that make you feel? Does this happen a lot? Like, what do you think in that situation and stuff? Because I think it's just humanizing the thing. I think we see so many statistics about this stuff happening, and it's really easy, like we know with statistics, for it to kind of just feel non-personal and like whatever, but it's individual people every single day. I think the UK is now 97% of women have been experienced harassment or assault, and it's like women have stories. Even just asking in the right way, to if they're comfortable sharing, I think you would be blown away potentially with how many people would want to share, as long as you're doing it from an understanding perspective. And I think that's the way that you can really understand what it's actually like to live with day to day, because I think even women, as I say, even women don't really realize what they're living with. It's become so built into our everyday that for a lot of women, they don't realize how not the same it is for men generally. And then when they have these conversations, they're like, oh yeah, of course I do that. Of course I, decide, do I have my earphones in so I look like I'm not interested, or not have my earphones in so that I can hear if someone's walking behind me, and all those little micro decisions that you make constantly. If you are going to intervene, the I is for intervene with integrity, try and be an active bystander. And that's essentially, there is a 5 Ds thing, which is direct, distract, delegate, delay, and document. You can Google that. It's 5 Ds, and it's quite a standard framework for how to intervene safely. But it's really important for the person who's experiencing the harassment in the situation to recognize that you're there. If you want to do things without escalating the situation, it can be good to just pretend you know the person who's being harassed, or ask a question, or even if you are in the situation yourself, trying to ask them, what did you just say? Especially with like the lower level things, if you want to call it that, like catcalling. I like to ask people to repeat it back, or ask them, what was that? Pretend you didn't hear, and then they often come, you know, if you're in a situation where it doesn't feel like that's going to escalate it, if it's kind of catcalling and stuff like that, they kind of quickly recognize maybe that wasn't okay all by themselves. So sometimes those things, again, you have to assess the situation, but those things can be good. But yeah, as a bystander, even if you can't do anything in that moment, if you can document what's happening, if you can write down as much information about the situation, the mode of transport you're on, the time, the date, whatever it is, the people involved, and report it. And even if failing all of that, even if you try to ask the person afterwards if they're okay, you know, especially if you're still in a public space, and just see if they're all right, like even that on its own can make the difference between someone then walking home and feeling so unsafe. We recently attended an event talking about this on public transport, and a girl was speaking and said that actually one of the guards from the train that she was on had finished her shift at the same time as her incident happened, and actually went all the way home with her. And I'm not saying that everyone can do that and stuff, but she said like otherwise she didn't know how she was going to get home because she was so terrified. So little things can make a big difference. Yeah, and then the last one is promote accountability. So not just for others, but even for yourself. Like, why do I say those things? You know, when you said something about women or about men, think, why would it be okay if I said that the other way around? Or is that true? Is that fact? Or is that just, you know, say like women are bad drivers or whatever, for example, is, you know, statistically actually false in terms of the amount of incidents that happen and things like that. So it's just trying to call out any behavior. And again, it doesn't have to be in a way that is confrontational, because that doesn't necessarily help. It's just questioning it back and being, you know, why did you say that? Or what do you mean by that? Or would it be okay if I said that about something else? And it kind of can help people almost unlearn their own biases by themselves if you call them out in that way, rather than being defensive, if that makes sense. So it's quite a good little, yeah, tool to just have that kind of helps you tackle on a personal level these different kind of systemic causes of harassment and, I guess, yeah, violence against women in general. So yeah.
Thank you, Amy. I totally appreciate we totally overshot the time that we had together, but basically in terms of taking action, the questions I leave you all with is, if you want to encourage open conversations on topics that matter, if you want to become better listeners, if you want to build a stronger community that aims to tackle to tackle the issues that matter, it's important that you consider what action can you take, what can you do that is going to be a part of the solution. Because today for me wasn't just talking about the challenges we face, but how do we take action to build a better society, a better community? And what are you going to do to be a part of the solution? I think every one of us has a responsibility. It's great to see that there are many men that have attended today's session, and people from different backgrounds, from different societies, from different cultures around the world that are here. And you know, being able to contribute to the collective discussion hopefully will mean that we can learn and grow together. You can get involved by becoming a HASSL ambassador. Amy, do you want to quickly talk through how people could do that? And at least maybe if you could put a link into the chat.
Yeah, so we literally have a page on the website that's called Get Involved. There's a ton of different things you can do as well as being an ambassador, like our survey and stuff like that. But yeah, if you sign up to become an ambassador, there's a small application form just to make sure you're joining for the right reasons. And yeah, and then it takes about up to a week to get approved. And then we basically have almost 2,000 now volunteers from all over the world that have literally different backgrounds, expertise, from different countries, and it's all about having focus groups, working on different initiatives together, getting perspectives, making sure everything is as impactful as possible. So yeah, whatever your skill set, there is something you can contribute. We have a group for parents, we have a group, as I say, for men, where we're doing focus groups, we have groups by profession, we have teachers, people work in law, people who yeah, work in HR, like literally every single type of industry. And yeah, we're essentially working on all different projects and initiatives. And at the moment, the big one is our online resources. So if you would like to contribute any skills or help us create them, they're going to be free for anyone to use. And we're just making sure they're as effective as possible. So yeah.
Amazing. Thank you, Amy. Yeah, Anise, if you could drop the link into the chat, it makes it easy for people to find where to go. With regards to our resources, particularly if you want the white paper on community, I think Leia's already put it into the chat. You can also visit our website, stress.org.uk. Leia will put the link into the chat as well, so you can find all of our free resources. If you're interested in finding out about our regular newsletters and any other information we share, you can sign up to our Stress Buster newsletter. And if there's any new information that comes from Amy and the team, we will do our best to share some of that on the newsletter as well to keep you guys all informed. If you want to learn about safeguarding, signposting and support, if you want to learn about advocacy and in particular how you can be champions and ambassadors of positive change, we have our Mental Health Champions program coming up in a couple of weeks. As a gift for attending today's session, you get it for the lowest price ever. It's normally £497. It's £222 for the next session. It is 10 hours worth of training, and it leads to you becoming a qualified mental health champion. And that's not just for mental health. I think that a lot of these skills that come out from that program are transferable into kind of allyship on the kind of conversations we're talking about today. So if you're interested in finding out more, Leia's just put a link into the chat, so feel free to have a look at that. If you do need to talk, if you're struggling with your mental health, there are some resources there on the screen that you can reach out for, and also you can drop us a message as well at info@stress.org.uk. Our next public webinar will be Wellbeing in Full Bloom, and that will be happening on the 18th of June from 1 to 2 o'clock. If you sign up for our newsletter, you will be first to be told how to register for that. And just before we finish, if there are any final questions, comments, feedback, if there's anything else that you'd like to discuss or share, Amy and myself are happy to hang on for another few minutes to do so. But I appreciate we are already 8 minutes over and some of you may need to leave. But thank you so much for being here. This is how we create change, by coming together and having those uncomfortable conversations and deciding what action are we going to take? What are you going to do to be a part of the solution, to create the world that we all want to be a part of? Our vision has always been from the very beginning to create a happier, healthier, more resilient world. And we're so grateful to you participating in today's discussion to hopefully contribute towards achieving that. I'll leave the last word for you, Amy.
Yeah, thank you everyone for joining. I know there's some ambassadors in here already, so thank you so much for continuing to support us. And yeah, if anyone else wants to find out more, please go and take a look at what we're doing. As I say, we're growing very rapidly, and the more support we have, the better. We're working on some really amazing partnerships with global brands, some really exciting stuff. And yeah, if you want to go find out more, please sign up to the mailing list, and go to socials. We post a lot on there, so yeah, you can see everything that we're doing. Yeah, and thank you so much for joining. And I think the conversation has been really great. And yeah, thank you everyone who contributed as well. Really appreciate it.
Fantastic. If anyone has any final questions, comments, feedback, we're happy to hang out for a few minutes to hold space for that before we close the meeting. Anyone have anything you'd like to share, ask, or discuss? Oh, fantastic. We appreciate you being here and hope to see you at the next session. Hi, Emma, go for it. Did you have a question, Emma?
No question.
Oh, no worries. Sorry, I saw your hand go up. All good. Fantastic. Okay, we're going to close the meeting in just over a minute. But again, have a wonderful rest of your day. And thank you so much for being here as part of this discussion.